Hello, viewers. Once again, we are coming to you from the University of Eastern Africa, Baraton, on our Baraton TV. Today, we are very happy to have in studio two lecturers from the School of Nursing, University of Eastern Africa, Baraton. The first person is Mrs. Elizabeth Rono. Welcome, Mrs. Rono. And the second is Mrs. Mary Njeru. Welcome.
Thank you very much.
We are very happy to have you today in studio. Last week, we put some emphasis on the use of medical masks. So we want to emphasize that this morning. And as you can see, we are all in our masks. But viewers, today our focus is on the role of nursing during this COVID-19 period. So we are excited this morning. We are happy to have the two of you in studio. The first person we have is Miss Elizabeth Rono. She is a young, vibrant nurse, and we would like to ask her some questions on the role of nursing and COVID-19. Mrs. Rono, we want to ask you this morning, what do you feel the impact of this COVID-19 is on the community?
Okay, in the community out there, one of the impacts that we've already seen is on the education. Right now, all the schools are closed, and the children and all the students are at home. This puts to there are some consequences that can come about due to this event, whereby the child is at risk of getting unwanted pregnancies or unintended pregnancies. Others, there is a risk also for child marriages, early child marriages. Mm-hmm. We have also other consequences whereby it affects the quality of education.
Mm-hmm. Thank you very much, Elizabeth. So you are telling us this morning that the children can become idle, and then they can become engaged in many other activities that are not good for them.
Yes.
Thank you very much. We are learning something new this morning, and we actually appreciate that. We also want to ask you another question. Actually, we have what kind of pressure do you think this COVID-19 has placed on our healthcare system?
Right now, the emphasis is on the prevention of COVID-19, and the government has put more emphasis on that. Unlike other situations whereby there is, the other services are running well, because the emphasis is equally distributed on all healthcare services. Some of the services which might suffer is the reproductive health services, whereby things like education on contraceptives, on reproductive health. So much emphasis is on corona, but the other services, like the one that I said, the reproductive health, child health, the care for the newborns.
Mm-hmm.
So much emphasis is on the corona, but the other services, not that they are very neglected, but the emphasis is on corona, and there are chances that other services might suffer.
Thank you very, very much, Mrs. Rondo. In fact, what you are saying to us is probably what is happening not only in our country, but in many other countries. Because when you have a pandemic of this nature and of this magnitude, we expect that more focus will be on that pandemic. And that sometimes other services, the priority has to be given to the pandemic, the coronavirus pandemic. Miss Njeru, I'd like to just ask you a question. Actually, you as an experienced nurse, okay, what do you think the role of the hospital nurse is as far as patient care is concerned? Let's take, for example, now you are working in the hospital, okay? What do you think the role of the hospital nurse is?
Thank you very much, Professor Jackie. The role of the nurse is enormous. It begins with the patient himself or herself, who is very anxious after confirming that they have coronavirus. If they have been tested and they have been told you are positive for coronavirus, they are very anxious, they have a lot of fear, and they wonder what next. So the first and most important role is to reassure the patient. We do not reassure the patient to tell them, you will not die, you will live. We don't do that. We tell them, we are going to do our best to make sure that you improve from your condition. So you reassure the patient to know that they have somebody who cares around them. The next thing you do is to isolate the patient from other patients, because in the hospital there are many patients. So isolate this patient to protect other patients. And when you isolate, you make sure, as the nurse who is taking care of the patient, you are wearing the personal protective equipment properly, so that you also don't catch the virus, get sick, and transmit it to others. You see, when a nurse gets the disease, you transmit to the hospital staff, to other patients, and to your family. So you have to make sure that you are well protected yourself as a nurse. And then you also ensure that this patient is well taken care of in terms of diet. The patient must be given a well-balanced diet, and especially fruits and vegetables, to make sure that they have enough vitamins in the body to fight the disease, because this is a viral disease. And you also make sure they have all the other care that they need, like bathing. They need to be bathed and feel, still dignified as a human being. They need to be maybe visited by a relative. You allow only one relative to visit of the patient's preference. You do not allow everybody or the whole family to be coming to see the patient, because it's a risky area. So those are some of the things we do. And there's also the aspect of spiritual health, because this patient is very frightened. They know others have died from the condition. You can also invite a priest of the patient's particular religion to come and minister to them. And that also helps them a lot. So it's important to note that this patient needs very good care, needs to be shown love. Love, because when you're told you have coronavirus, you already feel stigmatized even before you see people stigmatizing you. So it's good to deal with them as, good individuals. We greet them in the morning when you meet them, and just converse with them normally. Then all the things that the patients use cannot be mixed with other patients' things. Utensils, the things they use for taking medication, they are specifically for that patient. They cannot be mixed up with other patients, because then you'll be spreading the coronavirus. Limitation of visitors in the hospital is now becoming very crucial, even for other patients. Because if they come to the hospital and the patients with coronavirus have also passed through the corridors before they are isolated, you never know. It is not airborne, but it can be transmitted through droplets, and it can stay in the air for some time. So it's important to really limit hospital visitors as much as possible to ensure that we are reducing transmission to the minimum.
Oh, thank you very much, Ms. Njeru. I'd like to also ask you, now we just talked about the hospital visit. Mrs. Rono has given us a good idea about the impact on their community. But now I want to bring to the viewers' attention that this question we can answer, because I know that many people are thinking right now, what if you have a patient in the home? How do you provide home-based care? Because we don't know, there might be movement limitation in the future. Suppose somebody gets coronavirus in your house and you cannot go to a hospital. You don't have the means, or there is a restriction on going to hospital. What do you do, Ms. Njeru?
Yes, thank you, Professor Jackie. It is advisable if there is a family member with coronavirus to live in their own building alone, if possible. Uh, people would probably talk of a room within the house, but we are saying if it is possible, get a separate house for this person. Let them stay in that house alone, but let somebody close to the person monitor their movements but protect themselves by using the mask, by the washing of hands and sanitizing and all that, and possibly even cover their eyes. You can see even in the hospital, they have to cover their eyes because a few cases have been transmitted through their eyes. Now, when they are moved to the other house, the only person who can go there is that one person to take food and maybe to take clothes for washing, to check how the person is doing, but otherwise they stay separate from the rest of the family. It's not advised that they should be transported to the hospital unless they have developed respiratory distress. Now, respiratory distress can go so severe that they need to go to an ICU or the intensive care unit for ventilation, using a machine to breathe for them. But before that occurs, let them stay in the hospital. Now, regarding the care of this person while they are isolated, number one, they are very lonely. They need to be reassured. They need to be told they are loved and people are working hard to help them. At the same time, make sure their diet is rich in vitamins. We are talking of a balanced diet, which is what we normally eat: the carbohydrates, the proteins, the minerals, the vitamins, the water, and the fiber. But we are also saying here, select some few ingredients that have been said to work. For example, there are some spices that are known to work well, and they are commonly used for the cold, like use of ginger, use of cayenne pepper, use of honey, and honey has antimicrobial properties and heals the mucous membranes, and we are talking of mucous membranes of the entire respiratory tract, which has been attacked by the COVID-19. We are talking of fruits like lemon and oranges, which are categorized as citrus fruits, but very rich in vitamin C. So, when there is infection, vitamin C is very, very important because it helps with the healing process. So we will ensure that that patient is given fruits of that kind so that they can take. Another good ingredient to add in the food is there's garlic. Garlic is very good. It improves the condition of the patient. We have heard of a few cases, and we are almost proving that onion works very good when it comes to breathing problems. So if somebody can put some raw onions chopped into small pieces on a light towel and place it on the patient's chest, it tends to work very well in relieving the congestion in the chest so that the patient can breathe better. That is nature's provision.
Okay.
Yeah, nature's provision, because at the moment we don't even have a drug that has been proven to treat COVID-19. So diet is very, very important.
Thank you very much, Ms. Njeru. I think you have heard, viewers, what happens when somebody is at home and has the coronavirus. We have been told that the person should be also isolated, if possible, in a separate house. Do you have anything to add, Ms. Bruno?
Yes. In case you're not able to have a separate house, you can dial star. You can dial star 719 or call 719, and the government will direct you on how you will be helped, and they'll send an ambulance to come for you. You don't have to go to the hospital by yourself, but they'll come for you.
Thank you very much. I think you have just heard the importance of what our faculty on the campus from nursing department they have told us. In fact, they are saying that actually you can contact the government also by the number 719. I saw it on the news from the Ministry of Health. And that is important. And we are so happy to have you in studio today. You have told us important things. And this year, WHO actually honored nurses in their fight against the coronavirus. So I want to congratulate you as nurses and the knowledge you have given us as a community on how to control this coronavirus if it comes our way. What to do so that we are aware and informed, not only on the impact, but we are informed on what to do, even under lockdown. Like Ms. Njeru said, you can isolate the patient and give many various forms of treatment. And then, as Ms. Rono says, you can also contact the government for help. And they will give you help by sending an ambulance to collect the patient, depending on the situation. Just one last word from each of you to our community, to our students. What can you say to our students and our community at large, on campus and even out of the campus? What advice do you have to give? I will start with Ms. Njeru. Yes.
Okay. First of all, I miss my students so much and some friends from the community. I greet them in the name of Jesus Christ. I also want to tell people that continue observing the guidelines that the Ministry of Health has provided. You see, like using the mask. The mask is for covering both the nose and the mouth. Because I've seen some people putting the mask on the forehead, others putting the mask around the neck. When it is in those positions, it is not helping in any way, because the idea is to prevent the virus, which is outside in the air, from entering into the nostrils and the mouth. That is if somebody has coughed, because I had said earlier on, it's not really airborne. And then let's wash hands with soap and water and make sure the water is running, so that we make sure if we had touched surfaces that have the coronavirus, the coronavirus will be washed away. Let's sanitize with an alcohol-based sanitizer. And let's keep distance, social distancing of at least 1.5 meters. In some areas, people are not keeping the social distance, which is very, very wrong. They should ensure that you keep distance of at least 1.5 meters between you and the next person, so that in case somebody sneezes and they have the virus, you have a chance of not getting the virus into your respiratory system. So I think this is very important. If you have been in contact with somebody who has been diagnosed with coronavirus, just go to the health officials, tell them, I've been a contact. If you are advised to take quarantine, go to the quarantine for 14 days without complaining. And that will save very many other people from getting the infection. It's not a must that you turn out to be positive. You may actually come out very clean, because maybe your immune system fought for you, or you are not very close to that person that you got the virus. So it's good to report if you have been a contact of somebody with coronavirus.
Thank you very, very much, Ms. Njeru. Yes, Mr. Uno.
Thank you so much. Maybe I would want to add something on the use of masks. I've seen people putting on masks, but they are touching here in front. If you want to remove the mask, you remove by the straps or the what you are using to hold on the ears.
The loop.
Yes, and trust in the Lord. He will keep you well, and you also need to adhere by the government rules on the prevention of corona. May the Lord bless you all.
Thank you very much, Ms. Njeru and Ms. Rono. You have heard it, viewers, yourselves. Abide by the rules from WHO. Abide by the rules from the government of Kenya, the guidelines. Keep safe. See you next time. Bye-bye.